Hello, everybody. My name is Katia Villanova, and I am going to be talking about adolescent health. So, adolescents are considered to be people 10 to 19 years of age. There are about 1.2 billion adolescents in the world. 1 in every 6 people are adolescents. The burden of disease for adolescents are issues of sexuality, reproductive and mental health, impersonal violence, and road safety. When this is the point in life whenever healthy behaviors need to be adopted by the adolescents because these are the future adult populations. The leading causes of death of adolescents are road injury, HIV or AIDS, self-harm, lower respiratory infections, interpersonal violence, diarrheal diseases, drowning, meningitis, epilepsy, and endocrine, blood, and immune disorders. Mortality rate among adolescents is lower than among other age groups, but is much higher in Africa than the global average. In Africa, it is due to HIV and AIDS. In some countries, up to 1 in 3 adolescents are obese, and most adolescents at risk live in low to middle class countries. During adolescence, there will be physical, social, cognitive, and psychological changes. The physical changes will be puberty, which happens in girls from ages 8 to 13, and for boys, ages 9 to 14. There is muscle acquisition, growth spurts, menstruation, breast growth, voice deepening, and facial hair growth. The cognitive, social, and psychological changes are self-consciousness, low self-esteem, awkwardness or discomfort with those physical changes. They are susceptible to peer pressure. They improve their abstract thinking skills and introspection, and they have the tendency to focus on the present rather than on the future. The risk factors and social determinants will be poverty, and you can see that with unimproved water, the nutritional gaps, sanitation, and iron deficiency. The most important social determinants of adolescents' health are national wealth, income inequality, and the access to education. There are also many consequences during adolescence. Teenagers set their foundation for their adult health. There is profound health, social, and economic consequences. There's also adolescent pregnancy. The burden of disease has substantial cost, and these consequences can lead to substantial and long-lasting disabilities. Programs could include school health education courses, school counseling, and professional and private counseling. The goals are to eradicate poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, and combat HIV, AIDS, malaria, and other diseases.